In today's video, I'm telling you everything you need to know about blood stasis in traditional Chinese medicine, or what we call TCM, and how it impacts periods and fertility. Blood stasis can cause health concerns such as endometriosis, fibroids, adenomyosis, PCOS, and more complications when trying to conceive. I'll be combining insights from TCM masters like Bob Flass and Giovanni Macchioccio, and integrating functional and Western medicine perspectives. Let's break this down into clear, actionable steps. If you're new to my world, hi there. I'm Dr. Gina Rosea Terrani. I'm a board-certified doctor of acupuncture and Chinese medicine and a certified women's healthcare practitioner and integrative medicine. I blend 2,000-year-old healing traditions with modern science. Over the last 25 years, I've helped more than 2,000 women and couples over 30 get pregnant and have healthy babies. I would love to help you too. Please subscribe to my channel because every video that I share includes at least one simple step to help you on your path to pregnancy. Let's get started with what is blood stasis. In traditional Chinese medicine, blood stasis is when blood isn't moving smoothly. It's causing it to pool, thicken, or clot. Bob Flass, one of my teachers, beautifully explains that it's not just stuck blood or a clot, but it's a dynamic process where the qi stagnation combines with possibly cold or heat or trauma or deficiency, and that obstructs the free flow of blood. And Giovanni Macchioccio emphasizes that blood stasis often results with other imbalances like liver qi stagnation, cold invasion, heat, drying fluids, or weak qi failing to move the blood. This stagnation can lead to sharp, stabbing, fixed pain, especially in the lower abdominal area or pelvis. Menstrual blood that's dark or purplish, often with clots, irregular, delayed, or scanty periods. Conditions like endometriosis, fibroids, PCOS, and infertility. So when we think about periods, blood stasis can show up as painful periods or dysmenorrhea. This is classic. A woman might have sharp, cramping pain, especially with dark blood and clots, and we consider this as a qi stagnation that's transformed into blood stasis or cold constricting all the blood vessels. So we want to focus on warming the uterus, regulating the qi or oxygen, and moving blood. These are key actions to take. Irregular cycles are when stasis disrupts the flow, causing delays or even amenorrhea. Heavy bleeding with clots or sometimes scanty dark flow. These both point at blood stasis, with the quality of blood being thick, dark, or sluggish. Blood stasis, this is a major block to fertility, and here's why. Implantation issues are when the uterus is needing smooth, nourished blood flow. Stagnation hardens the soil, making implantation difficult. Conditions like endometriosis or fibroids, they're textbook cases of chronic blood stasis, often with heat, phlegm, or dampness that's complicating the whole picture. PCOS with stasis is when stasis in the ovaries or uterus contributes to irregular ovulation and thickened endometrial lining. Recurrent miscarriage can be caused by blood stasis, especially with underlying cold or deficiency. This may impair fetal nourishment. And from a Western perspective, we can map this to issues like chronic inflammation and immune activation seen in endometriosis or fibroids. Clotting disorders like anti-phospholipid syndrome, which can increase miscarriage risk, and this can mirror blood stasis with thickened, hypercoagulable blood. Metabolic dysfunction like insulin resistance in PCOS contributes to sluggish blood flow. Let's get into how traditional Chinese medicine finds the root causes of blood stasis and what we do to help alleviate it. And notice that I said root causes because there can be more than one problem. When I work with blood stasis, it needs a careful, personalized, and layered approach. There are several herbal formulas to consider when we are focused on moving blood and moving oxygen in the body. We also focus on herbs that warm the uterus if cold is involved, with herbs like cinnamon, ginger, and moxa. We also nourish blood and tonify oxygen, especially when deficiency is a factor. And adding these formulations in depends on which time of the menstrual cycle you're in. Then we have to open the Chong and Ren vessels to regulate menstrual and reproductive health. But don't worry about these channels and where they are. I've got you. I can help put all of this information together for you with an herbal medicine health plan. From an integrative perspective, we want to focus on anti-inflammatory diets that are rich in omega-3s and low in dairy, low in sugar, and processed foods. Castor oil packs, we want to use these to support pelvic circulation and womb circulation. Acupuncture or acupressure and herbal patches that we apply to these areas. And we put them on specific points as well as stress reduction to ease liver qi stagnation. Also, we consider adding in supplements like myo-inositol, NAC, DIM to support hormonal balance and PCOS and fibroids. So when assessing a client, I always look for red flags like severe stabbing pelvic pain, unrelieved by measures, heavy bleeding with large clots, or very scanty dark blood. This may point to fibroids, endometriosis, or structural lesions. Infertility with a history of miscarriage, irregular cycles, or PCOS. Signs of systemic blood stasis like varicose veins or unexplained bruising or easy bruising. So blood stasis is a key pattern in both TCM and integrative women's health. It underlies many menstrual and fertility challenges, from painful periods to endometriosis, PCOS, and infertility. And treatment involves not just moving blood, but addressing the root cause, whether it's stagnant oxygen, cold, heat, deficiency, excess, trauma, while integrating modern tools like premium herbal medicines, nutrition, supplements, stress management. Here are some at-home self-care practices for blood stasis, for periods, and fertility. We want to warm the uterus. Use castor oil packs over the lower abdominal area for 30 to 45 minutes, 3 to 4 times a week, especially between periods. This helps to improve circulation and it can soften adhesions. Apply warmth using a hot water bottle or heating pad during your period or when cramps occur. Warmth helps relax the vessels and it also will ease blood flow. You also can look at adding CBD topicals. They're very strong, they're very good for pain and for invigorating blood. And they just get rolled on topically and massaged in and it feels very good. You also want to move your body with gentle daily movement like walking, yoga, or qigong that supports circulation of the qi and oxygen or blood. And avoid prolonged sitting or lying down during your period because I know it might feel good when you're tired and you're not comfortable, but this can actually worsen stagnation in the body. So we do want to walk around and get some activity. We also need to eat to support blood flow and focus on an anti-inflammatory, blood-moving diet that includes warm, cooked foods like soups, stews, and bone broths. That makes them easy to digest. We want to use warming spices like cinnamon, ginger, turmeric, and add foods that move blood, such as steamed, dark leafy greens, beets, berries, and small amounts of red meat or liver, if that's appropriate for you. It's not for everybody. Avoid excessive cold and raw foods, especially in women with cold type stasis, and especially if you're on your cycle. Next up is stress management. Practice deep breathing, meditation, gentle stretching, or yoga to smooth liver qi. Stress often contributes to stagnation, which can block blood flow. Focus on acupressure and self-massage every day. I have an easy to use 7-day self-care course that includes one 10 to 15 minute ritual a day that you can pick and choose from and repeat as often as you like. Check the description for the Fertility Fast Track link below. It's an Audible course paired with a helpful visual guide with charts for support. And focus on stimulating spleen 6. That's a really popular acupressure point. This is about 4 fingers above the inner ankle bone to promote blood flow to the uterus. There's descriptions and photos of exactly how to locate that in my Fertility Fast Track mini course. Massage the lower abdominal area, gentle clockwise circles to encourage circulation. And there's also some points in the Fertility Fast Track to specifically massage. The 6th mention is one of the most important things to focus on, and that's herbal and nutrient support, which is a very strong integrative approach. Drink warm ginger tea to support warmth and circulation, and consider gentle blood-moving herbs like cinnamon and turmeric food or tea. The herbal medicine is very strong. They're premium grade herbs, and they're much more powerful than using at-home herbs like cinnamon and turmeric, which are still very good to use every day. There are some helpful supplements, but not everybody needs to use them. For women with PCOS or endometriosis, consider myo-inositol, NAC, omega-3s, and DIM under practitioner guidance, because you don't need to take everything mentioned in this video, and that's why it's best to work with a fertility specialist such as myself. You can find out how to do so from the link in the description below or comment my plan, and I will send you a link so we can get started. You want to track and observe your cycle. Keep a menstrual journal noting flow, color, clots, and pain patterns. This helps to identify if the stasis is improving over time or if it's getting worse. This is very important, knowing when to seek professional support. While self-care is empowering and very helpful, it's also important to seek guidance if pain is severe and unrelieved, which I hear a lot when I first meet with women who have endometriosis or adenomyosis. If your periods are excessively heavy or absent for several months, if you're struggling with infertility and recurrent miscarriage, these are signs of systemic blood stasis such as varicose veins and easy bruising. See a Western practitioner if you have concerning symptoms like these, and also use holistic medicine to work together. They integrate beautifully. And remember, blood stasis, it's not just about stuck blood. It's about restoring the dynamic movement of oxygen or qi and blood throughout your body. These self-care steps can help you support circulation, nourish your womb, and create an environment for balanced cycles and fertility health. The next step is to reach out and have a thorough fertility breakthrough planning session with me. You can find the link below to book this. I only accept about 3 to 5 of these appointments per month because I'm very thorough in creating a fertility plan for each of my clients. Remember, please subscribe to the channel. I appreciate you doing so. And also stay tuned for my next video where I talk about the top 3 signs of your fertility window that you should not ignore. See you then.